demonstrated healthy eating habits that focused on a balanced traditional Mexican diet as well as a normal appetite. She did, however, feel like her teeth were loose. Post-COVID, her appetite has been poor. She has lost her taste and smell, which may make eating less enjoyable. She has also been fatigued, which impacts her ability to cook and buy groceries. However, she does have access to a meal delivery system, Meals on Wheels. As a team, we believe it is important to educate Ms. Lopez on finding ways to make sure she is getting enough calories, protein, and nutrients throughout her day. This can include eating small meals throughout the day, drinking protein drinks, or taking multivitamins. We also know that people who are infected with COVID are at a greater risk for heart disease or stroke because it affects the inner surfaces of veins and arteries, which can cause blood vessel inflammation and blood clots, which compromise blood flow to the heart. Ms. Lopez has low HDL levels, which is the good cholesterol, and high LDL, which is bad cholesterol. So we'd want to educate her on limiting her intake of saturated fats like lard to help monitor these levels. We would also educate on regular dental exams and oral hygiene instructions. So on the next slide, here we have a couple of resources for Ms. Lopez that highlight what to expect after having COVID and what she can do to help manage any possible symptoms. And so then next, going into our next immediate need is focusing on Ms. Lopez's mobility and overall physical function. She has a gait speed of 0.625 meters per second, which puts her at a limited community ambulator speed, which means she is at an increased risk for falls, as well as her 2-minute walking test distance is well below her age peer norms. We want to do a progressive exercise program focusing on gait, speed, endurance, balance, and stability, as well as incorporating a fall prevention program. We believe that education and management of headaches and body aches can help with her overall well-being and mental health, and that education and energy conservation can help improve Ms. Lopez's fatigue. So going more into fall prevention, here are some pamphlets from the CDC on ways to prevent falls. So this can be another resource to Ms. Lopez, especially since here on the left is a pamphlet in Spanish to allow for easier translation. And then for our fall prevention program, we plan on incorporating the family throughout her care. We will suggest that they attend PT or OT to learn how to help their mom, Ms. Lopez, and how to do her exercises to be there to support her and express any concerns or questions. If the family cannot attend PT or OT, we can suggest filming on someone's phone so that the family still has access to what was done and can reach out to us as needed. We will educate on making environmental modifications and have the family come in to help her to her home with these modifications. So some of these modifications could include removing things she could trip over, like rugs, books, clothes, or shoes from the stairs and any place where she would be walking. To make sure there is no spread of COVID, Ms. Lopez's family made sure to get a COVID test and all tested negative, as well as we wear proper PPE.
Okay, so to dive deeper into some of more of Ms. Lopez's immediate needs, we'd like to take a look at some of her other lab work. So taking a look at the CBC, we can see that the hemoglobin and her hematocrits are low, and this can be contributing to her low energy and her fatigue. We'd also like to look at the BMP where her sodium is high. And as Bea had mentioned, we can use lifestyle modifications and dietary modifications to help lower that sodium by changing her diet. And another thing that I'd like to point out is her blood pressure. So we can see that her sitting blood pressure is currently 154/92. And when Ms. Lopez goes to a standing, her blood pressure drops down to 122/70. So this is actually indicative of orthostatic hypotension. And this is very dangerous especially for our elderly patients because it can increase her risk for falls. And just as Bea has mentioned, we'd like to get Ms. Lopez enrolled in fall prevention programs just to reduce her risk as in falls, especially since she has had 2 falls within the last month. And then her hemoglobin A1C related to her type 2 diabetes is also currently elevated, as our current goal is wanting to get her below 7. So these are just some of the lab works that we'd like to point out and that are pertinent to her overall health and well-being. So I'd also like to touch upon some of the medications that Ms. Lopez is taking. She is currently on glipizide 5 milligrams by mouth daily for her diabetes, and then hydrochlorothiazide 25 milligrams by mouth daily. So how can pharmacy help to improve Ms. Lopez's quality of life through her medications? We definitely be, as pharmacists, communicating heavily with her nurse case manager, as well as her primary care doctor, as well as her social care worker and her family, in trying to change these medications to better her overall health. One thing that we can do is change over her glipizide over to metformin. Metformin is actually the first-line treatment for diabetes, and it's also a very cheap medication. Glipizide is a medication that can actually cause hemolytic anemia, which can be causing those low blood levels that we were talking about earlier on the last slide. So changing her over to a metformin may be more beneficial for Ms. Lopez. And then in terms of the orthostatic hypotension, hydrochlorothiazide, which is a diuretic, can actually be causing that orthostatic hypotension or be contributing to it. So either lowering that dose to either 12.5 or even getting rid of that hydrochlorothiazide and switching it over to another medication can be more beneficial. And of course, we'd like to make sure that her family is okay with these changes that we'd like to make, as well as her doctor and her nurse case manager. We'd also like to talk with Ms. Lopez about overall at-home health maintenance, such as daily blood pressure readings at home, as well as making sure that she's checking her blood sugar levels with a monitor daily as well.
Now we will move into Ms. Lopez's long-term needs. One very important aspect of this was that we wanted to improve Ms. Lopez's quality of life. Ms. Lopez scored an 11 on the Patient Health Questionnaire, which is a tool used for diagnosing and monitoring depression. A score of 11 puts her in the moderate depression range. Ms. Lopez has had many challenges that have caused more severe depression. She lost her husband suddenly, and losing a close loved one and that companionship can take a toll on just about anybody. Also, COVID-19 has caused her to be separated from her family. Instead of spending time with family, she has spent more time alone at her house, away from family and friends. Another thing that has caused isolation in her life is that she has stopped her cleaning job and she does not see her close friends anymore. Her family and her job were two things that she really looked forward to and she enjoyed being a part of. With the loss of her job and no longer tending her grandchildren, she has lost part of her identity and her purpose, which can be challenging for anyone, no matter their age or circumstance.
And as Tate briefly discussed, in aims to improve Ms. Lopez's quality of life, we will incorporate a team approach throughout her care. The speech pathologist will conduct a motivational interview and collaborate with the other team members to ensure we're all on board with helping Ms. Lopez achieve what she wants. Motivational interviewing helps ensure autonomy, relatedness, and competency by helping her explore and resolve doubt in her plan of care. Questions include, but not limited to, what are Ms. Lopez's interests or hobbies, and does she currently use any strategies to help herself, and what are they? Our goal right now is to help her envision a future where she participates in meaningful activities, and asking Ms. Lopez if this is something she wants to pursue as part of her plan of care is very important. The scales of cognitive and communicative ability for neurorehabilitation will be administered to figure out what areas of attention, memory, or visuospatial skills are impaired. We know there are many functional areas to memory, for example, short-term, long-term, episodic, procedural memory. And there are also many areas of attention, including focused, sustained, selective, divided. Therefore, pinpointing these areas will help us formulate SMART goals and capitalize on her strengths in order to promote those successful interventions. We want to all collaborate effectively on these results to figure out how the whole team can target her goals effectively. So in those weekly team meetings we discussed earlier, we will consider timing of services for each profession, because we don't want to intervene when Ms. Lopez is too fatigued. For example, cognitive communication therapy from the speech pathologist after occupational therapy will not be appropriate because Ms. Lopez might have very low energy during that time, which will not set her up for a success in therapy. And as a team, we decided virtual support groups are important to address her social isolation and loneliness. We want to emphasize social interactions and stimulation to avoid declines in the cognitive ability she currently presents with. And an interpreter may be considered depending on which virtual support group she participates in. For instance, Circle of Friends in St. Louis is a group rehabilitation model for older people who experience loneliness from time to time, and the aim is to alleviate and prevent this feeling. Other options are of course available as well, including cognitive stimulation therapy, which is an evidence-based practice focusing on improving cognition in patients with mild to moderate dementia. We would like Ms. Lopez to participate in a group with emphasis on client-centered goals and one that facilitates positive energy and discusses coping strategies amongst each other as a group of individuals that might be going through similar challenges or situations. We also wanted to include an activity Ms. Lopez can engage in with her grandchildren. Here you'll see a personal interest visual aid or even a memory book that her grandchildren can help her with by creating a page of themselves. Ms. Lopez's page can include a list of her favorite activities and hobbies to discuss those with unfamiliar communication partners. She may use this as a resource to fall back on if she finds herself having difficulty participating in those meaningful conversations in those support groups I mentioned earlier. And another option while considering Ms. Lopez's minimal access to healthcare are smartphone apps. This app specifically allows speech, language, and cognitive therapy exercises anytime and anywhere. Constant Therapy creates a customized program that will be tailored to her recovery goals, including targeting those areas of weaknesses to improve or help maintain her cognitive functioning.
And like we mentioned in our plan of care, we'd like to educate Ms. Lopez throughout this care plan process. And one of those education aspects is on vaccines. So Ms. Lopez did express disinterest in getting vaccines, as she feels that they currently make her sick whenever she gets a vaccine. And vaccine education is something that is easy to do, and a lot of healthcare professionals can help Ms. Lopez understand the meaning of vaccines and why they are there to help us. So her nurse case manager, social work can even help with vaccine education, pharmacists, her doctor. So there's a variety of healthcare professionals, as well as her family, since her daughter is a nurse, that can help her get educated on vaccines and the importance of them. And this is one of the educations that everyone can do, is vaccines do's versus vaccine don'ts. And there's a lot of misconceptions on vaccines and what they contain. But one thing that we want to make sure that Ms. Lopez knows is that vaccines are there to protect us, and they go through rigorous clinical trials in order to go through the safety and efficacy just to establish their safety, as well as the side effects. So knowing that vaccines can cause side effects, but they usually go away within a few days. And that vaccines also don't cause any autism, or things like how vaccines don't overload the immune system and how they don't contain any harmful substances such as mercury. So this is just something simple that all of her healthcare professionals can do, as well as her family. And Ms. Lopez can also access some free resources on vaccine education from the CDC. There's plenty of resources out there that we can show her in order to collectively get that mutual understanding with Ms. Lopez, so that she becomes familiar with what vaccines are. And we also want to make sure that she is as comfortable as we can get her and on board before we administer any vaccines. So we want to make sure that the team communication is important throughout as well.
So in conclusion, we learned a lot from this case study. We learned that geriatric cases can be very complex. Many factors go into formulating a thorough and effective plan of care, and that the patient, Ms. Lopez, and her goals need to be at the center of the plan of care. We learned that getting the family members heavily involved in the care process is also important to increase adherence and understanding. Some things that went well was that we saw viewpoints from different healthcare professionals, and everyone was very respectful of each other and their professions. However, some things that were difficult included finding time to meet due to our busy schedules and losing one of our team members, so that was one less perspective and healthcare professional to help with this case. But overall, we had lots of fun and it was great working with each other.